Asian male blepharoplasty, subtle crease instead of regular double eyelid crease. Getting comments looking tired at work. I get tired of having to raise my eyebrows to look alert and focused. I know a few men who have gotten their eyes done. However, though they are lower than what I imagine Asian women's surgery is, I still think the crease is odd looking. The picture I posted has eyes I consider to be more attractive as a male. What was done on him that gave him sharp eyes with subtle creases? In summary, I'm wondering if it's possible to get this kind of blepharoplasty where the crease is extremely subtle.
Thank you for your question. You stated in your question you submitted your own photo as well as a photo of an image of someone whose crease that you feel are nice, that you're tired of raising your eyebrows to be able to look like you're more alert, and you have some opinions about the look of both male and female Asian eyelid surgery. And so with the single photo you've submitted of yourself and then looking at the photo of the more ideal crease that you believe is right, we have to establish a couple of things, and one involves first understanding your eyelid position. You see, with the single photo you submitted, the fold over your eyelid can be something that is essentially just a skin fold, or the eyelid itself can be a little bit low. And that eyelid being low is referred to as ptosis. Now, it doesn't necessarily mean that you have to have the ptosis corrected. Ptosis means drooping, and usually that's associated with the muscle called the levator muscle that has been developed, or I should say congenitally, or something that you were born with was low. And so if someone has ptosis and you do just eyelid surgery alone or develop a crease, they're not going to be happy because their eyes are still low. And therefore, we have to ascertain whether or not you have ptosis. There's also something called pseudo ptosis, which means the fold of skin hanging over makes the eyes look like they're drooping. And so this requires a physical exam. We basically would roll the skin in and see whether or not you have true ptosis or pseudotosis. Now, as far as the control of the eyelid crease is concerned, since you want something very subtle, then the eyelid crease can be customized to the level of length that the crease can be defined. And you can have something subtle. If you look at this picture that you submitted of the desirable eyelid crease, essentially it's only in the outer aspect of the eyelid that you see a crease. And when you get towards the inner aspect, you see no crease. So I would question whether or not this is as ideal as you believe it is. Because if you feel like you have to raise your eyebrows to see better and look more alert, you may need to see more of your eyelid crease to get that result. And you may want to just play with that a little bit. Just look in the mirror or take pictures or have someone take pictures of you with your eyebrows raised and look at how much of your eyelid is revealed. It's very important that you have a vision in mind of what you want. It is nice to have models to look at and say, this is somebody who I like, or I want to look like, I should say. And then see with your doctor how close to that it can be achieved. You have to be realistic. Everyone's anatomy is unique. Your eyes may be slightly more deep set. There may be a difference in the skin quality. There are many dynamics, so you can't always be as exact as trying to mimic someone else's appearance. But I think you should meet with experienced, qualified cosmetic surgeons who do a lot of Asian eyelid surgery. I would anticipate, if there is no true muscular ptosis, that you would probably be able to have a non-incisional upper eyelid surgery to define the crease, but probably at a lower point in a more subtle way, so just the outer aspects are defined. And that might be the way to go, but again, look at how you look with your eyebrows raised. I think you'll see more of your eyelid crease, and you may be better off with a more defined crease, but you can certainly figure that out and see whether it's realistic to achieve what you are looking to achieve. Communication is so critically important, that you and the doctor really understand each other and that nobody feels misunderstood. A lot of times patients come to us, and as a cosmetic oculofacial plastic surgeon, as a specialist who does revision surgery, very often I find that it isn't about the doctor doing not the ideal procedure, but rather a miscommunication and a difference between the vision of the patient and the vision of the doctor. When we do our surgeries, we actually routinely will draw with the patient in the exam room before going into surgery, and they will know exactly what I'm planning to do, so that we're clear about the whole strategy and what the expectations will be. Helps to alleviate a lot of stress about the unknown. So, with that being said, I hope that was helpful. I wish you the best of luck. Thank you for your question.